The lungs are a pair of spongy organs in your chest that form the center of your respiratory system, responsible for exchanging gases between the air and your blood. When you inhale, oxygen enters your lungs, travels through tiny air sacs called alveoli, and transfers to the blood. Simultaneously, carbon dioxide, a waste product, moves from your blood into the alveoli and is exhaled. The diaphragm, a muscle below the lungs, drives the breathing process by contracting and expanding your chest cavity. Gas exchange. Lungs take in oxygen, which is vital for all your body's cells, and remove carbon dioxide, a waste gas. Respiration. They enable the intake of air through inhalation and the expulsion of air, a process controlled by your brain and the diaphragm. Vocalization. Lungs provide the airflow necessary for your voice and speech. Location. The lungs are located in the chest cavity, thorax, on either side of the heart. Lobes. The right lung is divided into 3 lobes, upper, middle, and lower, while the left lung has 2 lobes, upper and lower, to accommodate the heart. Alveoli. Millions of tiny, thin-walled sacs called alveoli are located at the ends of the bronchioles, and they are the primary sites for gas exchange. Pleura. Each lung is encased in a thin membrane called the pleura. 1. Inhalation. When you breathe in, the diaphragm contracts and moves down, while chest muscles expand the rib cage, drawing air into the lungs. 2. Gas exchange. The air travels through the trachea and bronchi to the alveoli. Oxygen moves from the alveoli into the blood vessels, capillaries, surrounding them, while carbon dioxide moves from the blood into the alveoli. 3. Exhalation. The diaphragm relaxes and the chest cavity returns to its resting position, pushing air, now rich in carbon dioxide, out of the lungs. Lung cancer is a type of cancer that starts when abnormal cells grow in an uncontrolled way in the lungs. It is a serious health issue that can cause severe harm and death. Tobacco smoke is the leading cause of lung cancer. Symptoms of lung cancer include a cough that does not go away, chest pain, and shortness of breath. It is important to seek medical care early to avoid serious health effects. Treatments depend on the person's medical history and the stage of the disease. The most common types of lung cancer are non-small cell carcinoma, NSCLC, and small cell carcinoma, SCLC. NSCLC is more common and grows slowly, while SCLC is less common but often grows quickly. Lung cancer can cause several symptoms that may indicate a problem in the lungs. The most common symptoms include cough that does not go away, chest pain, shortness of breath, coughing up blood, hemoptysis, fatigue, weight loss with no known cause, lung infections that keep coming back. Early symptoms may be mild or dismissed as common respiratory issues, leading to delayed diagnosis. Treatments for lung cancer are based on the type of cancer, how much it has spread, and the person's medical history. Early detection of lung cancer can lead to better treatments and outcomes. Medical treatments include surgery, radiotherapy, radiation, chemotherapy, targeted therapy, immunotherapy. Surgery is often used in the early stages of lung cancer if the tumor has not spread to other areas of the body. Chemotherapy and radiation therapy can help shrink the tumor. Doctors from several disciplines often work together to provide treatment and care of people with lung cancer. Supportive care is important for people with lung cancer. It aims to manage symptoms, provide pain relief, and give emotional support. It can help to increase quality of life for people with lung cancer and their families. Lung cancer fighting foods. You've probably heard quite a bit about the foods that may lower your risk of developing a cancer such as lung cancer. But what if you are already living with the disease? What should you eat to raise the odds in your favor? It can be confusing to think about how food can fight cancer, even to scientists. Part of the reason is that there are many different ways in which this can occur, and there are many processes within each of these mechanisms that may be affected by what we eat. 1. Pears contain fluoretin, which causes non-small cell lung cancer cells to die in the lab. In a recent study looking at non-small cell lung cancer cells grown in the lab, fluoretin, which is found in pears and apples, markedly induced programmed cell death, apoptosis, in these cancer cells. 2. The researchers felt that fluoretin may someday be used as an adjunct in the treatment of non-small cell lung cancer. Fluoretin not only played the above role with lung cancer cells, but in another study also enhanced the anti-cancer effect of cisplatin, a common chemotherapy drug used for people with lung cancer. In addition to its possible effect on cancer, fluoretin may reduce fibrosis in the lungs, such as that commonly associated with radiation therapy. Pears, as well as apples, contain a phytochemical called fluoretin, that is thought to have anti-tumor activities. 2. Green tea. Green tea may enhance the effectiveness of the chemotherapy drug cisplatin. Green tea is another food that appears to do double duty when it comes to lung cancer. Not only has green tea been found to have a preventive role in the development of lung cancer, but may be of benefit to those already living with the disease. While studies on humans have yet to be done, researchers have looked at its effects on both human lung cancer cells grown in the lab and in animals. Compounds including theaflavin and epigallocatechin 3-galatate (EGCG) were found to potentiate the effect of the chemotherapy drug cisplatin, which is often used to treat lung cancer. 3. In one part of the study, the effectiveness of cisplatin in eliminating cancer cells was increased by a factor of 7. Keep in mind that most green tea does have caffeine. If you are sensitive to caffeine or it keeps you awake, you may want to find a caffeine-free variety or concentrate on other items on this list. Also keep in mind that the bottled green tea you find at the store may not be the best choice. Compounds such as ECGC don't last, and the amount found in most soft drinks is very low. On a last note, you may want to skip the creamer as dairy products can combine with and neutralize ECGC. Consider adding a touch of lemon instead, which enhances the absorption of this compound. 3. Salmon. Vitamin D in fish may inhibit the growth of lung cancer cells. Vitamin D has received a lot of attention in recent years, and a diet high in vitamin D may have some benefit for people with lung cancer as well. Researchers observed non-small cell lung cancer cells containing an EGFR mutation to see what effect vitamin D3 may have. 4. The cells were treated with 25-hydroxyvitamin D3, the breakdown product of the vitamin which circulates in the blood. It was found that in this setting, vitamin D3 inhibited the growth of lung cancer cells. Vitamin D, which is found in fatty fish such as salmon, mackerel, and herring, appears to have other health benefits as well, and a deficiency in vitamin D can lead to many medical problems. In addition to dietary sources, vitamin D can be absorbed outside from the sun, but sunscreen interferes with this process. Given its role in cancer and how easy it is to know your level with a simple blood test, talk to your oncologist about having this tested. Of all the vitamins and minerals in our diets, vitamin D may be the hardest to get in dietary form. Being outside in the sun in shorts and a t-shirt for 15 minutes, however, delivers a very healthy daily dose. That's not always possible in northern climates, or for other reasons such as chemotherapy drugs, which raise the risk of a sunburn. If your level of vitamin D is low, your oncologist can talk about the best supplement to improve your level. 4. Ginger. Ginger may lower the risk of lung cancer spreading. Ginger may help with chemotherapy-induced nausea, but it may play an even bigger role for people living with lung cancer. Ginger contains a compound 6-shogol that may help prevent the development of lung cancer, but through its actions on the pathways that help cancer to spread, may lower the risk of metastases from a cancer already present. 5. Su Yl, Hung Jy, Zai Ym et al. 6-shogol, an active constituent of dietary ginger, impairs cancer development and lung metastasis by inhibiting the secretion of CC-chemokine ligand 2, CCL2, in tumor-associated dendritic cells. J. Agric Food Chem, 2015, 63, 6, 1730, 8. DUI 10.1021/JF504934M. Evidence of the benefits of ginger were noted in treating lung cancer cells in the lab, and it was also found that dietary ginger intake reduced the risk of lung cancer metastases in mice with lung cancer. Since metastases are the leading cause of death for people with cancer, this is an important finding. Ginger is thought to have other health benefits as well, particularly in helping people with chronic pain. 5. Capers. Capers may inhibit the growth of lung cancer. Some people think of capers as pea-shaped pickles, but these tiny flower buds, native to the Mediterranean and some parts of Asia, have much more to offer. Capers are one of the highest known sources of a compound called quercetin, which is a powerful antioxidant that appears to inhibit the growth of several cancers, especially cancers of the lung, brain, blood, and salivary gland. Quercetin inhibits a signaling pathway in lung cancer cells that is necessary for the cells to divide and multiply. 6 earlier studies found that in addition to inhibiting cancer cell growth, quercetin also plays a role in programmed cell death, apoptosis of cancer cells. Other foods rich in quercetin include dillweed, red onions, blueberries, apples, and green and black tea. 6. Curry. Curcumin, a component of turmeric used in curry, may inhibit the invasive ability of lung cancer cells. Turmeric, an essential ingredient